Evening, everyone, and welcome. We made it to Thursday, or as I like to call it, Friday Eve, which means we got one more day to go, and we've made it. Thanks for taking time out of your schedule again to join us for part 4 of our COVID in childcare series. We're super excited for our guest tonight, Miss Melissa. She's joining us from KDHE. But before I turn it over to her and everything, I just kind of want to introduce the team to you that has been, working throughout the weeks to get this series up and going. Myself, my name is Heather. I'm the program manager of the Child Care Health Consultant Network, and the other people, but I really can't give myself credit. It really has been the team putting it all together. So I have to give a shout out to Miss Tanisha. She does a fabulous job of keeping us on track. So kudos to her. To Miss Rachel, she's our tech person. She makes sure everything goes nice and pretty and, no technical difficulties. And then also Miss Erica, our nurse, she's been the one helping us really present the last couple of series. So an awesome shout out to Miss Erica. Sarah, she's, keeps us all in line. And we have a good time together too, but she keeps us in line, I promise. And then lastly, Miss Jessica, has been supporting us throughout this and also is supporting our Spanish speaking providers as well. So Miss Jessica, I'll turn it over to you so you can welcome them also.
Thank you. Hi, good afternoon, everyone. Thank you for joining us. Buenas tardes, gracias por acompañarnos a las que hablan español. Aquí estoy, cualquier cosa me pueden mandar un mensaje en el chat, o pueden decir mi nombre y yo les puedo interpretar o vemos cómo, qué información tienen preguntas de. Gracias. Thank you.
Thank you, Jessica. So with that, I will just give a shout out to our funders who make this work possible. So KDHE, in partnership with the Children's Cabinet, are what keeps the Child Care Health Consultant Network up and running. So we couldn't do this work without them. And tonight we actually have a representative from KDHE. Miss Melissa is with us, and she is going to answer the questions that you guys submitted. So I sent that over her way, and she's had a chance to review them and gather some information for you guys. So with that, Miss Melissa, I will turn it over to you. Rachel will stop sharing her screen, and then at the bottom of your screen, Melissa, you should be able to start sharing your slides.
Hey, thank you. Let me pull up my slide here real quick. It is not wanting to cooperate. So I will just introduce myself real quick while I am getting that up and going. My name is Melissa Schoenberger. I am the Field Services Supervisor for KDHE. That's a mouthful to say all at one time. Basically, it's a fancy title for that I work with all of the surveyors. I provide technical assistance and training to all of the field staff. So all of the surveyors that come into your facilities, at some point I have had some kind of communication, contact, training, just everything with them. I myself have served as a surveyor, so I understand field work. And so as I move to that, I'm going to go to my second slide and say thank you. Because I know it's easy for me to be a surveyor, to work at KDHE and knock on your door, but it is not easy. I have decided after I've been at KDHE for almost 20 years, and I have been in the field service, the CCL program in the field services for almost 17, and I could not do your work on a daily basis. So I always want to let you know how much I appreciate providers and everything that you do. I'm a working mama, and I cover half of the state when I was in the field daily, and I could not have completed my job without my daycare provider, and then my child care center staff, and then eventually my school age program staff. So I feel like I have intersected with every type of provider as both a parent, a consumer, and a surveyor. So again, a big shout out and thank you to all that you guys do. So that being said, I do appreciate all of the questions we received in advance. It really helped me be able to frame everything regarding COVID-19 and licensing, hopefully in a way that will give you a better understanding tonight as we end our session. I'm constantly amazed that we are in February of 2022. I still think I remember exactly what I was doing in February of 2020. I think it was one of the last concerts I went to in Wichita and a lot of the big events. And so I feel like I have been able to center my life pre-COVID, and now, 2 years in, everything's after COVID. So have a great appreciation for everything that you do. I don't think you may understand, but when March of 2020 hit, there were states that shut down their childcare licensing programs. There were states that shut down their licensing facilities. We did not. Kansas stayed very fluid, very open to meet the needs. And you guys have embraced the challenges. So as we go through some of these questions tonight, some of it will not be new information because you've been doing this and living it for the last 2 years. So that being said, let's just go ahead and segue right into where you have some wonderful resources. I don't know if you guys are very familiar with the KDHE website. I'm on it every day, so I understand it. But for those who don't go on it every day, it's hard to navigate. And I'm going to admit something. In December, KDHE just revamped their whole website. Like one day as a worker, I received an email and said, hey, the next day you're going to have a soft launch for a new website. And we're like, okay, maybe they're going to change the banner. Maybe they're going to change something so that we could just have some little pizzazz to the website, because I always thought that's what we were lacking. They changed the whole website. If you are used to going to the KDHE website to grab forms, to grab applications, just to get updates, and then or to log on to the provider portal, you probably saw something that looks drastically different in the last month. We are working really hard to fix some of that. Even one of our banners up top, it shows a child, you're getting engaged with the doctor, getting their ear looked at. So you're on the right CCL website. We don't do any sort of, I don't expect providers to be pulling out that very fancy item and checking in children's ears. So know that you're still on the KDHE childcare licensing website, and it just looks very unfamiliar. We are working on that. But we do have embedded in the KDHE website the COVID microsite is what I like to call it. Literally, if you go into Google and you put KDHE COVID microsite or even resource site, you're going to get here. And you're going to get to the COVID site. This is very different than the childcare licensing site. So I want to make that very clear. I myself, I'm going to be very honest with you. When I'm on our main KDHE website, I don't know how to get to the COVID site. I can't find the link. I literally have to have it bookmarked and go into my Google and do KDHE COVID microsite. And that's how I get here. We will have this available. I did embed the hyperlink, and I can share this with the health consultants and you can have it. But if you've not been on the KDHE microsite, this is where all of our information lives for childcare providers. Again, it is not on the KDHE CCL website. It's on the microsite. And then you're going to find a toolkit on the homepage of the KDHE COVID microsite. And you're going to see this lovely little link down below that says childcare and foster care. That's where all of the information lives for childcare providers across our states. If you haven't been on that website, you may have had documents forwarded to you by your surveyors. This is where those documents live. So if you lose them in your email and you're wondering, oh, I can't find that latest update that my surveyor sent out to me, go to this toolkit link and you're going to find all of the information. And then this is what the next piece looks like. We have one for childcare facilities, we have one for foster care, and we have FAQs. Basically, the first 2 stars that I have on this page to share with you, those are going to be the documents that you are most going to want to have at your fingertips. It's the FAQs for childcare facilities and the guidance for childcare facilities licensed by KDHE. And you're going to see that there's updates. We just made an update this week. Prior to that, you weren't really missing out on anything. We hadn't updated our documents probably for 4 months. We didn't have anything new to add. So anytime CDC makes a really big announcement that will affect our early childhood settings, then you're going to see a major update. And I'm hoping that this is it for a while, because I literally updated these documents on January 25th. And then we had a CDC recommendation on January 28th, and then we updated them and pushed them out to the field. So these are very living, breathing documents, and they get pushed out all the time. We try to stay current. So again, if you've not been to this website, totally encourage you to. And again, if it's new information, then, even these first 3 slides are nuggets of information that I feel like were beneficial to me joining today. But this is what our frequently asked questions page looks like. Frequently asked questions, FAQs for childcare facilities. We've been updating these. We launched the first FAQs in March of 2020. So you're going to see FAQs that were embedded from the very beginning and to up to date. If there's something that is not relevant anymore or doesn't, there's been new guidance, we've removed it. So be rest assured that nothing on this document is out of line with current practices. And again, always look for the most current date. So I started reviewing your questions that you forwarded to Heather, and I thought, okay, these were some that I can answer from the FAQs. So this will give you an idea of how you can use your FAQs. One of the first questions I want to tackle tonight is this one that was sent in. It's really not necessarily COVID related, but I wanted to definitely address it. I feel like I'm bothering them when I call for guidance, but the rules change so fast that I can't keep up with them. Is there an easier way to stay on top of the rules? Well, first of all, what I really want to address is that we are never, and when I say we, I speak to the whole surveying field. We welcome your calls. We welcome your emails. Yes, sometimes do we get on the phone and maybe we sound a little busy, just exhausted. I think that's the same that you guys feel after, when you're dealing with children and you have parents calling you. So it's sort of the same sort of relationship, but please call all the time. Call, email. You can even email in the KDHE through the KDHE website if you have a question. We are never bothered. So just definitely wanted to set the tone that I appreciate you guys reaching out, because that's the relationship we want to have with providers, is a supportive relationship. But what I can tell you is there's no new rules. And when I talk about rules in my world are regulations. There have been no regulation changes due to the pandemic. There may have been some regulation waivers, which if you've been a provider since March of 22 that you lived with, such as if you had a new employee at your daycare and you were unable to get their fingerprints because your sheriff's department was closed. We had a temporary waiver, which allowed for you to just submit them name-based. And then we said, okay, eventually you're going to have to get them done. And that time has passed. That was last fall. Everybody has to now have their comprehensive background check, fingerprints done, if that was required. And this also applied to training. So we had a federal waiver that said if I'm new, so if Heather was new to a daycare and she could not get her training done, her health and safety training, then we had a federal waiver for it. We didn't say that we didn't implement a new regulation. We didn't remove the regulation. We just had a temporary waiver to allow for providers to get that training when it was available. All of those waivers have disappeared. We sent all of that information out to the field through surveyors, through our no reply emails to facilities, and now all regulations do apply. So be rest assured, there were no new rules, meaning there were no new regulations. And I think really where the frustration lies is what's to be stayed on top of is possibly the guidance, and mostly the guidance around quarantine. And we'll get to that here in a minute. And again, next question, are there any new rules that have changed for daycares because of COVID? No. Regulations have stayed the same. We, especially health and safety. I mean, if anything, we did an overemphasis on making sure that you were following your health and safety regulations. Good hand washing, social distancing. That's just a best practice. It wasn't even a new rule. So be rest assured that if there was any regulation change, you would be a part of that conversation, because that's actually embedded in state law, that if there is any regulations to be changed, KDHE has to engage the regulated community. That includes our lovely partners with Child Care Aware and providers. And so nothing has changed. I can't stress that enough. Okay, other good questions. Can you give me some ideas for reducing the spread for kids under 5, and how to talk to parents about drop off and pick up of children without them having to enter the house without making them feel bad? We actually have speaking points to this document that I really am encouraging you guys to use so that you can have that, so you're better informed. But when we talk about drop off and pickup, KDHE actually does limit outside visitors. That does not include the local licensing surveyor or necessary maintenance repair worker. So if you did, you had, at that time, we had questions centered around, oh, what if my refrigerator came out? Do I have to close my daycare to allow that person to come in? No, there's things that do happen that we still want you to keep your normal operating procedures, but we did allow you to limit access to parents. So if you wanted to give kiddos at the door and you literally hand it off at that point, and it's still perfectly fine. And I think part of that conversation with parents is really engaging them, as I'm sure your health consultants and this network would support, is limiting exposure. That really the conversation stems from that we want everybody safe. And this is just a safety protocol to keep, because, we don't know where the parent has been. I know they have that evening access to their children, but really we're still trying to add that extra little safeguard to keep everybody well and safe. So that's where I think that conversation really stems from. It's about having that relationship and ensuring that you are doing the best you can as a provider to keep everybody safe. Ideas for reducing spread. We have daily routines. It's a really great, I only gave you two pieces, and we can look at the document here in a minute. Gave you a few snippets of really talking about what you can do to maintain your facility and keep it as safe as you can. Making sure you have daily routines for children, ensuring frequent hand washing. There's actually even an additional section on ventilation. The importance of having windows open. Maybe today's not the day to do that, but I'm just going to share, a little hidden piece for me. I go down a TikTok rabbit hole at night because that's my way of decompressing. Follow some teachers, love elementary school teachers and their TikToks. And the city of New York actually promotes ventilation. I follow a few teachers where every day you see they're wearing stocking caps and they have big sweaters on and they have mittens, and they keep windows open and they keep that ventilation going. Don't always recommend it again today. But we've had a really unseasonably, 60 degrees the other day. Great day, throw those windows open, get outside, promoting ventilation. And then I think there's some extra CDC documentation of what you can do to help your house. And you extra safeguards. So again, look at these documents. How do they apply and what can you do to take your home to that next level? Okay, so here's the burning question. Oh, sorry, you guys. I accidentally paused my screen and then I did that. What I have been getting and surveyors get daily is what does quarantine look like, Melissa? What should we do? The guidance on January 25th spoke to that CDC is still updating. They were still deciding what the guidance looks like for early childhood settings. So KDHE used their applied what current guidance was for early childhood settings, and that was 10 days. And updated all of our documents. So it was very fluid with current recommendations. And then January 28th, 3 days later, after we pushed out the information again, CDC met and they brought out new guidance for early childhood education settings, which are 5 days. And so we quickly, because we knew that would be confusing to providers, we wanted to give you guys the most information. We quickly updated our documents and threw them out to the field. So basically it states if staff and children ages 2 and older are presumed are confirmed, so confirmed in our world is positive, to have COVID-19, they should isolate for at least 5 full days. After isolating for 5 days, if they are asymptomatic or their symptoms are resolving without fever for 24 hours, they can return to the early childhood education program and wear a tight-fitting mask consistently to minimize the risk of infecting others. CDC, though, if you go onto their website and discusses masks use during nap time, they recommend removing the mask because then it becomes a hazard. So just keep that in mind. Similarly, staff and children who were close contacts but not up to date with COVID-19 vaccination or do not have confirmed COVID-19 in the past 90 days should quarantine for 5 days. So basically it's that, just a full 5 days, and wear a well-fitting mask consistently for an additional 5 days. For staff and children who cannot wear a mask, including all children under 2 years of age, the safest option is to isolate or quarantine for 10 full days. ECE programs can consider multiple factors to determine isolation and quarantine policies. So really what it gives you the minimum requirements, but you as a business owner have the right to make a different business decision, meaning you can make something stricter, and more stringent. And what I love about the Health Consultant Network is that is right within their wheelhouse. So their staff is available for you to help work on some of those sick policies. And it shouldn't just be isolated to COVID-19. You really should be looking at your sick policies of when children show up with diarrhea, when children are throwing up. There are multiple, youth diseases. I hate to lump that and use that term, but there are the childhood sicknesses and illnesses besides COVID-19 that you deal with on a daily basis. So I really encourage you, you do have your base premise now for what quarantine is across the state. But I really hope that you are connecting and using this lovely network to build upon your sick policies, because parents should be very, very aware of what your threshold is, because you are not expected to take care of ill children. That's if a child does not feel well, they shouldn't be with you. They don't want to be with you. They want to be with their parents. They want to be in a safer area at home. We all want to be at home. Even my 19-year-old now, she's at Fort Hays and goes to school there. And even though it's just across town, when she's not feeling well, she comes home. She wants her chicken noodle soup and she wants mom to give her ibuprofen and take care of her. So same premise with little people. So any question that you had regarding quarantine, whether that was an exposure, whether that was a parent, because this speaks to close contacts, this will apply. So I really encourage you to take a minute, read it. If you have questions, I encourage you to contact either your local health department. That's your first point of contact. Our KDHE has a wonderful COVID-19 hotline. And I realized I don't have that on any of the slides, and we will, Heather, I'm assuming you have probably the emails to the participants or anything, we can get that to them. Providers use it all the time. In fact, they have they've been coached for very specific licensing questions. Every time we get an odd question, we throw it to our COVID hotline. They make sure they add it to their list so that you guys are getting the most up-to-date answers. Okay, had some other questions that really not necessarily COVID related, but I felt like they would be beneficial to the conversation. I literally cut and paste it. So if there's any spelling errors, it's because you guys submitted them that way. If there's missing a period, I believe in honoring how the question was submitted. Do the same with my surveyors. Okay, this one, I really threw back to my team when I met with them today in the field. How does one get the parents, and I'm assuming to be honest about what is going on in their home? That's a challenging question. As a surveyor, I got that question too. And because it just doesn't apply to COVID-19, it applies to mom and dad may be fighting. Mom and dad are going through a divorce. Nobody wants to share that information with you. I always encourage you to have that really honest give and take relationship with your families so that somebody feels comfortable to share that information to, because kids' behavior will change based on what is going on in the home. I'm a social worker by trade. I did foster care. So I saw a lot of this in the trenches. Kids just respond, and providers have no idea what's going on for 9 hours until a parent gives them just a little bit of nugget of information. On our medical record, we really do need to tweak it. There's like one very small question at the bottom that says, what's going on in the home, basically. Really, that should be on the top, like, what's going on? Can you help me understand so that I can better serve your child? So really, there's no magic bullet to that question. It's just having that, really stressing to your families of why it's important that they share what's going on. But personally, my sister-in-law is a daycare provider, home daycare provider. And I do know parents have been not so truthful with her about where they've been, exposures, and it's exhausting. They hear about it after the fact of, oh, and I think she really hears about it when some parents, family members have gotten really sick. Oh, well, did I not tell you? This is what we did at Thanksgiving. These are all the family members, and this is now who has COVID, and it's a little too late after the fact. So it goes back to also having good business practices and policies. She revamped her whole business plan after that. Her whole parent agreement after Thanksgiving got really tight about what her expectations were. But then as a sister-in-law and somebody in the childcare licensing world, I remind her, well, you have to be just as truthful with your families of where you've been too and what you've done. So it's a two-way street. Don't know if she always likes that reminder, but I do remind her because I think it's a good premise to have. Is it appropriate to ask families to test or stay out 10 days if their children have a bark-like cough, congestion, or runny nose? That's a business practice. Pre-COVID, what we would recommend is having a good illness policy, which might include a doctor's note saying there's nothing wrong with this child and they can go back to daycare. We've seen it and encouraged it now. It's a practice. I would say 10 days without some sort of test might be excessive. So you really want to, it's about engaging the parents in what's going on with that child. Really encourage them that, I may be drawing a line in the sand until you take this child to a doctor. I am not going to have them back because there could be lots of reasons to have that seal-like bark. I'm drawing a blank on what that sometimes is. And you might need a steroid. It has nothing to do with COVID. I know and if anybody remembers it, feel free to come off mute and remind me of what that is. But it's that you really bark. It's
Croup.
Yes, Erica, croup, and it has nothing to do with COVID. So really encourage you to look out, and kids just get runny noses. Kids, when they teeth, my daughter had an ear infection every time she broke a new tooth. Nothing to do with anything. That's how her body responded. So again, really encourage whoever sent that question in to work with your health consultant network so you are best informed of what an illness policy looks like. Okay, what are the masking requirements and repercussions for not masking? We are not the masking police. We provide a recommendation. We have the guidance. Especially now with the 5 days, we really encourage it, but there would not be again, we nowhere through the last 2 years have we knocked on your door and said, hey, you're not wearing a mask, we're going to come in and do a complaint. What we have looked at is if you are actively symptomatic, you're positive and you are still working, and your parents find out, they will call us, and yes, then we might have to have a long conversation, and that could lead to a complaint, because remember, you have to run your facility with the health and safety in children in mind. But then again, we're not really weighing, does she have a mask on? Does she not? It's about the knowledge and the exposure. So, but again, we are not the mask police, and there is no set regulation towards that. In fact, over the last 2 years, we've just only provided mask consultations to facilities. This one was a really good question. When navigating COVID guidelines, what supersedes what? Local guidance, health department, or survey KDHE guidance? Kansas infrastructure for the local health departments is amazing. I've always been intrigued from a policy standpoint of the framework of the local health departments, because every county has one. And it's just amazing when you think about our state. Local county department directives through not just the pandemic, through there was an outbreak of measles and somebody was exposed, have always superseded state law. So state has a base premise, just a baseline, and then the locals can put in something more stringent, and they have across during COVID. We've seen it. As now we're getting into 2 years. Local is pretty much in line with KDHE's guidance. And some health departments, I'm just going to be very transparent, don't answer COVID questions anymore. They send them all to KDHE, to the hotline. And that they have that right too, because it is a public health, and KDHE does represent public health. So it was really hard to gauge this because every county is different. So just be rest assured, you start with your local health department. Your local surveyors are pushing out information, but if they choose to send you to KDHE, that's perfectly fine too. Again, KDHE's hotline, not my team. We are not nurses. We are not trained. We would give you either the guidance to if it's easily found in guidance, or we would send you to the 1-800, the 1-800 line. So again, every county is just a little bit different, but 2 years in, we're definitely seeing more locals just referring to CDC guidance, referring to KDHE. Okay, number 5, how to go about encouraging children to wear masks. So in preparation for this, I reached out to one of my staff who has a child in a child care center, a young one, and who has a kindergartner. I'm like, Nicole, how do you get them to wear your masks? What do you do special? And she said, well, I will tell you, Melissa, that my younger one who's in child care center is more compliant than my kindergartner. And it's a boy. He just listens. He just follows the rules. So I don't think there's any magic bullet, except she did say, as a mom, she said he loves superheroes. So we had a lot of masks. So we bought a mask that he loved to wear. So he had Ninja Turtles. He has Batman. At Halloween, he had spiders. You know, she really goes through above and beyond to make sure that he's excited about wearing his mask. And she even did a little checking. She's like, checked with the center director. They're really, kids just follow the rules. They're just compliant. They follow your lead as a staff member. So encourage you just to keep modeling that good behavior if you want them to wear it. And kids will do that. Again, I'm always amazed. It's groupthink. When you go to a childcare facility and they're serving like sauerkraut, or they're just serving beets, something that you know kids don't really like, but because it's all groupthink and somebody else is eating it, everybody does it. So really encourage you just to keep that good modeling. But there's no magic bullet to wearing the masks. I just think it's good behavior and good practice. Okay, how cohort grouping can be used to prevent a shutdown since we are a one-room classroom with no outside people involved. Cohorting is a very specific decision made by the local health department. KDHE does not. We are aware of it. We do ask facilities to share that with us. But if that is something that you want to engage in as a child care facility, you first have to discuss that with your local health department. And they will assess risk, mitigation factors, especially if it's a big facility. But it is something that I would first encourage you to discuss with your local surveyor, and then we would connect you with the health department and make those decisions. This one, where to get the strips to check the bleach water. So I had to really put my thinking cap on and like, okay, this must be a childcare center. They have a 3-compartment sink, and they're not only washing, rinsing, they're sanitizing. So regulation does not say how you sanitize. It just says that you do sanitize. And I will tell you that because those regs are antiquated and they've been in existence for like 20 some years, and we've not updated. So I literally Googled sanitizing strips, and I found them. So whoever wrote this question, Heather, if your team ever gets asked, what do we use to sanitize? What do we do? There's tablets, and then there's the strip to check to make sure your water's at a level that sanitizes. Very easy. If you can't tell, Google is my best friend. So really encourage you guys to use, just use it and find that resource. And if you're a home provider taking that extra level, kudos to you, because it's not required in regulation. So that's something that you're really engaging at that best practice level to keep everybody safe in your facility. And really, a lot of questions a vast majority of them dealt with quarantine. So I just sort of lumped them all together and then had the other one. So we have a few minutes. Anybody have any questions that you'd like to ask or add? And then if not, I can show you the website and where to find those documents at.
Melissa, I do have a question from a provider. They would like to know if they call KDHE, is there someone that would speak Spanish that they could talk to?
You know, I would like to say we do, but it depends on the area. If their surveyor, that's a really good question. I'm going to ask the 1-800 hotline what they do if somebody does call, because if you're contacting your surveyor and you're in the Southwest area, usually you have we can get you connected with a surveyor who speaks Spanish. In our Southwest area, that's Patty Clausen. And then in other high areas, there's usually an interpreter at the local level in the health department. But I don't know that answer for KDHE, and I will get that back. Jessica, I will find that out. That's a really good question for the hotline. I'm going to base it off of the hotline.
Okay, that sounds good. Thank you, Melissa.
You're welcome. Okay, so here is the just like I said, the COVID resource site. And then I really want to show you the guidance, because I think it is beneficial to providers. And it's all really done in a nice manner. The table of contents is updated, so it's a quick search. If you are looking on your computer, your laptop, anything, and you hit Control F, and you want to just go quickly to anything like a mask, it'll show you where it's all in the documents. You don't have to really spend a lot of time looking for it. Just always like to share little hints that we forget when we're looking at big documents. But I really do, it talks about sanitizing and cleaning, vaccination, but ventilation was new because in the last at least 5 months, because KDHE, CDC updated their ventilation strategies to work with providers. So it's been a minute since you've looked at it, really look at the ventilation component. And all of the hyperlinks work. So if you are interested in going to someplace, and they all work, because I painstakingly had to look at all of them. So they are very usable. But the FAQs, if you haven't been on there, they contain some of the same similar information, but we really wanted to put it in a way that was provider friendly, because they were questions from you guys. Why are some facilities closed and others open? Am I required to close my facility? No, you're not. Some of them are relevant. Some of them have been a little, they're like, my license is going to expire soon. Can I renew my license? Yes, we do want you to renew your license. Even if you are temporarily closed due to a COVID exposure, still renew your license, still do your normal business practices. So really good questions. May I limit the number of children enrolled to fewer than what is stated on my license? Providers had a really hard time at the beginning of the pandemic to say no to parents. They wanted the okay to KDHE to do that. You don't need our okay. You're a business owner, but you can enroll. You can have 2 kids if you want, and that's okay. I never want a provider to feel bullied into taking more kids than they should. That's the great idea about being your own business owner. So again, really want you to spend some time looking at that. It has a lot of great information. And encourage you to just read through them. And if there's no additional questions, I'm going to say thank you for having me tonight. And I'm going to turn it over back to Heather and let her finish out the rest of your presentation.
Awesome. Well, thank you so much, Melissa. And I echo for the CCHC and Child Care Work Canvas. Thank you so much for joining us this evening and sharing with us. And I mean, I learned stuff. So, I mean, that's always a good thing. So I will ask this, Melissa, because I'm sure it will come up afterwards. Would you be okay if we shared your slides with providers from this evening? Because I know there were a lot of links on there. Would you be able to send that my way? And we can definitely get those links sent out to providers as well.
That would be great, because I do want to add the hyperlinks to them. So I will, and I'll save them as a PDF with those links being active, and we'll get those to you.
Wonderful. Thank you so much.
I think Erica had a question.
Oh, sorry.
I was clapping for you.
Oh, thank you. We're used to see. Thank you.
Anybody have any questions for Melissa before we do our little, our very brief little rundown? So.
Could you clarify the quarantine time when a child is living with somebody who tested positive?
That goes back to a close contact. It's all 5 days. It's sort of easy to just follow now, because again, CDC does recommend 10, but if they're not showing any symptoms and there's no fever, then it's 5 days.
So not an additional 5 days after the 5, but
No, the way it, and I'm hoping we have this really lovely chart that KDHE put out that shows quarantine, isolation. That all became antiquated last week, and they're working on updating that. So we will get that out to surveyors too, and then we will send that to you guys. And Heather, I'll make sure your team, I don't know if your team has all of those lovely documents that KDHE puts together for isolation and quarantine. But as soon as it gets updated, we'll make sure everybody gets a copy.
thank you.
But always go back to your local health department, because again, something can be a little bit more stringent.
Any other questions for Miss Melissa? No. All righty then. Well, we just wanted to kind of, since this is our part 4 of our COVID and childcare series, we thought it would be a really good way to kind of, what better way to kind of wrap up our time together by doing some fun little trivia. So we thought it would be really good to kind of review what we talked about in part 2 and part 3. So we came up with some questions. You do not have to come off mute. We made this a chat friendly game, so you are more than welcome to put the answer into the chat. They're all either true or false or multiple choice. So again, you can just be, in the comfort of your home and don't have to come off of mute. So I will read the questions for you, and we'll give you a couple minutes to answer and put it in the chat. Sarah, if you want to help be our a commentator too, because I know you love this part, girl. I know you love this part. But Miss Rachel, take us to the first question, please, to wrap us our time up. All right, true or false? Using hand sanitizer creates an antibiotic resistance. True or false? I feel like I need to get some music going now. Oh, maybe I should pull up the chat. Anybody want to guess? True, false? No. All right, we got a false coming in.
Got a couple falses coming in the chat. False.
Oh, they're coming in hot now.
Yep. False.
All right. I think false might be the verdict here. All right, Miss Rachel, reveal it for us. It is false. So it does not. It does not contribute to creating antibiotic resistance. So the best way, wash those hands. I mean, hand sanitizer still works. Doesn't work in this sense, but hand washing with warm soapy water is the best way to truly do it. Sorry, I'm stumbling all over myself right now. All righty, next one. Let's see here. So the safest way to prevent contaminating surfaces is to, and then there could, and pick all of them that apply. Wear gloves for most tasks, wash hands often for 20 seconds, use a hand dryer, use an alcohol-based hand sanitizer. So which one are the answers?
And if
And
you
I'll give you a
still,
hint, there's more than one.
If you still want me to be the answer girl, Heather, I'm here
Yes.
for you. If you
Okay, you
got
got-
it, you
yes.
take it away. Okay.
No, I'm tapping you in, girl.
Ooh, we've got
Ooh.
somebody using
they're
fancy
stamping.
tools to
Okay, I like it.
answer.
And we've got a couple coming in saying A and B in the chat. A couple more saying A and B, but very nice. Look at that. I love that interaction on the screen.
All right, Miss Rachel, you ready to show us?
Okay, you guys, this is kind of a tricky one. So when I was still doing facility inspections, I would see this a lot. People kind of get this magical glove fallacy thing going on. We think when we have gloves on, we're protected from everything. So what I would see is like just constant glove wearing, like gloves, but we were touching things and then we were touching other things. And then we were with one group of kids and we were with another group of kids. So truly, actually wearing gloves can increase contamination of surfaces. There are certain tasks, of course, that you need to wear gloves. For personal protective equipment, if you're cleaning up blood or bodily fluid spills, diaper changing, you can also glove up for that, but it cannot replace hand washing. So if you do wear gloves for a task, just remember and be mindful that you still have to wash your hands for that 20 seconds after removing those gloves. And then the other one, of course, if there's nothing visibly soiling your hands, you can use that alcohol-based hand sanitizer.
All right, true or false, vitamin and mineral supplements can cure COVID-19. We got false. I'm seeing a couple of falses. All right, Miss Rachel, take us home to the next slide, girl.
Okay, so you guys are correct. Those supplements can help support your immune system, make it function well, but they can't cure COVID.
All right, Miss Rachel, here we go. So how is COVID-19 spread? And again, could be potential multiple answers here. Through water while swimming, through droplets when talking, on infected people's shoes, through droplets from singing. All right, we got the stamp going again. I love it. So we got an A and a D, and oops, and I see stuff in the chat as well. B and D, oh, now we're all coming in. B and D, we have somebody picked all of them. All right, Miss Rachel, show us what we got.
So B and D are the correct answers. There's nothing to support that COVID could be transmitted through water while swimming. In infected people's shoes, there's also no solid evidence to link those things. However, especially if you have infants in your program and like you're a home-based facility, encouraged to have people remove their shoes at the front door so that they're not tracking in any waste or contamination in general that would be on the bottoms of shoes. But you guys are right, aerosolized droplets, so coughing, talking, sneezing, singing, that would all spread COVID.
All right, true or false, COVID can survive in cold weather. Oh, we got true, true, true. All right, nobody's saying false so far. True, true, true. We got trues all the way, Miss Erica.
And it is true. So I don't know if you all remember at the beginning of the pandemic, environment can contribute to the stability of a virus, but what we've seen with COVID-19 is that it very much does survive in all kinds of weather. So yes, it can survive cold weather.
All right. Some COVID-19 vaccine ingredients include, and again, possible multiple answers here, tissues like human cells, antibiotics, metals, or messenger RNA or mRNA. So what does it include? D. I feel like I could sing some songs with the answers. I need a tune to go to.
Heather, I'm disappointed that you didn't wear your game show host attire.
I know.
You really talked it up. You really
I know.
talked it up.
I couldn't find my bow tie though. I couldn't find my bow tie. All right. So I think D is what they landed on, Miss Erica.
Yep. And you guys are right. So, and when I wrote this question, it was about really looking at the Pfizer and the Moderna vaccines. Johnson & Johnson has a little bit different mechanism, but those do have messenger RNA in them, which is a pretty cool little thing. So some vaccines have like weakened or dead viruses in them, but messenger RNA doesn't work like that. So what it does is it goes inside our bodies and teaches our cells how to make a protein that triggers an immune response. And so, yes, it has messenger RNA.
All right, and I think we got time to do one more. True or false? I get better immunity from the COVID-19 vaccine than I do from being sick with the virus. We have true. I'm seeing true come in. I think we're getting all, trues are coming in hot now. All right, Miss Rachel, show us the answer.
And that is true. The body has a more consistent and dependable response to the vaccine than it does to the actual COVID disease.
Thank you. All right, and with that, because I know we're right at our time here, and I know how busy you guys are and your evenings are so valuable. So I just want to, give a shout out to everybody. I know several of you have been with us from our part 1. So I really do hope that you had, you found this enjoyable, you found it educational, beneficial to you. We certainly enjoyed hanging out with you guys and just helping you navigate this crazy time. And I echo what Melissa said at the beginning is thank you, thank you, thank you. You don't hear it enough. But from everyone at Child Care Aware of Kansas and CCHC team, we cannot thank you enough for everything that you do. So with that, before everybody heads out for the day, I wanted to turn it over to Miss Jessica really quick so she can just update our Spanish speaking providers on something as well. And then we will wish everybody a good evening.
Thank you, Heather. I do see some questions coming up in the chat about the recording for part 1 and 2. So Heather, I don't know if we could release those. I believe we did record.
Yep.
Okay.
So the recordings are out there. If you get the Child Care Aware of Kansas weekly provider email, all of the recordings are attached to that the newsletter. And I believe one was recorded, but no, it's out there. It has been out there as well. So you can get 1, 2, and 3 have all been recorded, the same as this one. We'll be releasing this one as well next week in the provider email.
Thank you, Heather. Buenas noches a los que hablan español. Va a haber una parte 5 el día 18 de febrero de 1 a 2. Les voy a estar mandando la invitación. Será en español. Toda la información que se ha dado en la parte 1, 2, 3 y 4 se va a traducir y se les va a mandar en español y van a tener la oportunidad de hacer sus preguntas. Entonces vamos a estar mandando esa invitación pronto. Gracias.
Thank you, Jessica. And then Sarah, really quick, because I know I saw something come in the chat as well. A provider had asked about new grant opportunities. I didn't know if you wanted to tackle that one.
Absolutely. Thank you so much, Heather. So we are working through new opportunities all the time and would love to talk a little bit further about how we can support childcare providers through various parts of their journey. We do have some startup stipend supports available, as well as some health and safety funds available to childcare providers that are eligible that meet certain criteria. So if you would like more information on those specifically, please reach out to the Child Care Health Consultant Network and we can get you set up with a consultation to dive in. And then we can also get you set up with referrals as more opportunities come alive. So thank you so much.
And I know Miss Rachel put on the chat for us, if you would like to connect with us, our email is on there. And of course you can put a note in the chat as well, and we would be more than happy to connect with you. But our email is there. And if you reach out through that, Ms. Tanisha will get in touch with you and get you, you know, pointed in the right direction with the consultant in your region. And of course, our website is there as well. So again, unless anybody had any final questions, I just want to thank everybody for hopping in here with us for part 4. And I hope everybody has a fantastic evening and stay warm. So take care, everyone. Bye.
Thank you, Heather.
Thank you, Melissa.